Hi, my name is Elizabeth Houck, and on behalf of my advisor, Dr. Dracobly, and I am excited to share our poster, An Evaluation of Conditioned Aversive Stimuli Associated with Past Traumatic Events on Choice Making and Avoidance Behaviors. People with intellectual disabilities and autism spectrum disorders face a greater than average risk of exposure to traumatic events, including abuse, neglect, and medical trauma. Unfortunately, limited verbal communication skills can make it difficult for people in these populations to access appropriate assessment and treatment for stress-related disorders. On this poster, we present data from a young man with ID and ASD and a communication skill set of about 2 to 3 signs. He was referred to our clinic for a regression in toileting, and when we did his initial evaluation, we found that he also had a history of exposure to potentially traumatic events. We also noted that there were several items in his environment that could have easily been associated for him with those past traumatic events. And we were not able to remove those items from his environment because they were things that were needed for his care and for the care of other people in his home. We also found that he showed pretty variable latencies to make choices when these items were closer to him or when he could see these items. So we evaluated the effects of these items on his choice latencies and on his resistance to staff prompts. And then we decided to teach him a break request. And our break request we were able to honor by moving these items farther away from him or out of his line of sight just for a brief period of time. What we found was that moving these things and allowing him this break as an option improved his compliance overall. We're hoping that this could help behavior analysts to develop assessments that could improve treatment for people with challenging behaviors who may have a history of exposure to traumatic events. As our society has become more aware of the effects of trauma on physical and behavioral health, we're hoping that behavior analysts will be able to improve assessment and treatment strategies for some of the most vulnerable populations who may not be able to verbally report about past trauma or the effects of past trauma on their current behavior.